Dr. Li Zeng, an acupuncturist with over 27 years of clinical experience, shares her advice about maintaining optimal health in today's fast-paced modern society using acupuncture, Chinese herbal medicine, and more. Her practices are in Boca Raton, Florida, and Boston, Massachusetts.
Hello, this is the licensed acupuncturist, and I have my friend Susie who has pharmacy degree. Yes, and she had acupuncture experiences for the treatment for different kind of purpose. How many years you have treatment?
Probably 20 maybe for different things.
And you started your career as a pharmacist, a pharma.
Yes, I have a doctor of pharmacy degree.
Yeah, that's 6 years training, is it?
Actually, when I went to school, they didn't have, I did add-on degree, so it was almost 8 years.
8 years. So with all the build-up pharmaceutical knowledge, and how come you can come to acupuncturist?
So it's interesting. I ended up, I had initially a problem. I was traveling in Europe and came home and had a problem with my stomach, and my traditional doctor couldn't find anything wrong, and he sent me to his son, who actually is MD trained, but also did holistic medicine. And when I was in an accident, a car accident, I hit my head. He said, you got to do acupuncture. This guy's in my office, and that started me going. And I just kept going for a variety of different things. I really believe that you need to use all the different modes of medicine available, whether it's allopathic or homeopathic, alternative. There's not one thing that does everything.
Exactly, and with your background knowledge, you do use medicine. Remember, you had a surgery in one of the middle finger, right?
Right.
And then you heal so fast. Usually, the hand surgery make people have like different kind of pain afterwards, but you didn't have the pain.
No, actually, it's interesting. I went to acupuncture. I tried to go in Michigan right before I had surgery, and I may have gone once right before my surgery, and then afterwards I was only in Michigan maybe for 2 or 3 more weeks, and I went twice more. And then when I came down here, I thought I was okay from my finger, and sitting on the plane, I was sitting funny, and the next day I woke up, I had a pain in my thigh, and I said, I'm going to acupuncture. I'm not going to be on all this Tylenol and muscle relaxers. And I found Lee. She was nice enough to answer the phone. She fixed that, and I told her about my finger, and then we went on to that, and then other issues. I ended up with a toe infection. She helped me with that. So one thing just kind of leads to another, and even boosting your immune system so you don't have problems with antibiotics when you have infections.
So you were on 2 runs of antibiotics.
Right.
For the toe?
For my toe.
So did you fracture?
No, actually what happened was I got a sinus infection first, so Lee helped me so I could heal faster from the sinus infection. When I came down on the plane, not only did I have a pain in my thigh, somebody was sick, and I ended up with a sinus infection and an antibiotic, and she helped me, so that sped up the healing, and then no problems with my stomach because protecting my stomach, in addition to probiotics and things like that. And then I went to the beach with my dog. We're in Florida, and I must have scraped my toe and got an infection in my toe and was on antibiotics again a few weeks later. And of course I was still seeing Lee, and she's like, I can handle that. So that was a pretty bad infection it turned out to be.
You didn't fracture the toe, right?
No. I scraped it, and I ended up with an abscess, and it had to get drained. And then once I was on antibiotics and it wasn't getting better, I got it drained, and then I rammed it into the high chair when my granddaughter was visiting, and that made it worse because I banged my toenail. It ended up falling off. But throughout this, Lee was helping me with all the different scenarios with this poor little toe, which didn't have a lot of circulation because fingers and toes don't have a lot of circulation compared to the rest of your body. They're harder to heal. So I was very grateful that Lee was able to help my system from the immune perspective, boost my immune system, help the antibiotics work better, keep my stomach from having a problem from the antibiotics, increase the blood circulation to my toe and to my finger, so that healed, and any like other muscle things to help the tension that I would get from all these calamities. It's just, acupuncture is a really important tool to add into the armamentarium of everything. It really complements what Western medicine can do.
That's very powerful compliments, because you do have so much knowledge about
Right.
medicine.
Right.
And when you were on the second run of the antibiotics, did you ever had a yeast infection?
No, I actually, with either one, I never did, but I take a super strong probiotic. But with the second round of antibiotics, I was particularly concerned because they were so close together.
Okay.
And I know that from between the probiotic and the acupuncture therapy, I'm sure it was very helpful, and I never had an issue. But like I said, I use a lot of different tools, and
Yes.
acupuncture being one of them. That's really important for, especially when you have something out of the ordinary happen, not just to maintain your health. But I also like acupuncture. I think it's really good to maintain your health. I don't know if people really understand about acupuncture.
No, that's why I think you gave me the powerful speech that you really have to be patient to be treated at least once a week or twice a week,
Right.
right? And how many years you already have the acupuncture?
So I probably did acupuncture for 20 to 20 or 20, more than 20 years, and then I was doing fine. I also did other things like hypnotherapy.
Yes.
So I use a lot of different modes of just being healthy and exercise. Eating, I try to eat healthy, but with this finger incident, it really drove me because I knew there was nothing that would help me just with medicine if I didn't go to acupuncture. And that's what really brought me back up in Michigan, and then coming down here with my leg and then my finger and all these other things. I'm like, I need to be back in acupuncture because it just supports your whole health of your whole body. I don't think people realize, no different than you have, we have a blood whole system in our body with blood flowing, our vascular system. We have a whole system in our body with our nerves. All of our nerves are connected, and that's a whole system in and of itself. But we also have a whole energy system that you can't really see the same way. So people have a hard time understanding, but if any of those meridians or in that energy system gets blocked, it disrupts the ability for your body to heal. So you have to unblock that, just like you have to unblock your vessels if you're having a problem, or unblock nerves if you're having a problem. So acupuncture really is the third piece to what makes your body run.
That's really, really good comments. And the other thing, I was thinking, you always like the top of the head.
The top of the head is great.
Yeah. We will always put like 4 needles there, or 5, and then do you stop thinking, or you're practicing meditation?
No, for me, what happens is, well, I know that those are really strong acupressure points and acupuncture points. And for me, what it does, it just helps everything relax. And I don't necessarily do any meditation, but I usually fall asleep. She puts on great music. But the points in your head are very strong. I don't know from my own background. It's a little above my pay grade. Maybe you can comment on it. But I find I find the needles in the head are very strong in terms of just helping your whole body relax and realign and just function better. And I'm very in tune and sensitive to energy work anyways, so maybe I know the difference with getting that versus not, but I find the needles in the head are really, really helpful.
Were you on any medication long term? Like you retired, right?
Yeah, I retired from a 40-year career, which was great.
40 years.
40 years.
Whoa.
I put my 40 years in. but doing a lot of different things and ultimately ending up in actually working for multiple pharma companies on the research and education side with nationally and internationally known people around the world. It was really fun, but no, I just, I take a lot of supplements and vitamins, and I take a couple of things to prevent osteoporosis, which is just replacing what I don't have. But other than that, I don't take anything.
Oh, wonderful.
I'm just
no
really,
medication.
No. I mean, a couple of things are prescription for osteoporosis prevention, hormone replacement therapy, calcitonin for replacing calcitonin that I don't have. But these are things based on blood tests that I'm deficient in, not in something that pharmaceutically is going to do something different than it's just no different than taking a vitamin from my perspective. I'm just replacing stuff that I don't have. And that's really what everything that I take is, just to replace what I don't have.
That's wonderful.
Yeah. So no, I don't take anything. And I have good genes. I'm very grateful.
Yes. And you take care of your mother, right?
Yep. Take care of my mom. I was very close with my mom and my dad. And my dad lived to be almost 92, and he was healthy till he wasn't the last 6 days. Of course, he had different things, and my mom is pretty good. She's 89, and it's interesting because my son was having some issues. I sent him back to the holistic doc, and my daughter-in-law actually came here because she was having some issues. Remember?
Yeah.
And
the high stress.
Right.
Yeah.
Right. A lot of anxiety and stress. Just they have a little, less than 2-year-old, and they both work full time, and they both have medical backgrounds. My son's a physician, and my daughter-in-law's a nurse practitioner. She was a little reluctant about acupuncture, but the minute she came and met Lee, that was it. She couldn't believe the difference that it made. So that's another person. She's not here. She's up north, but she was somebody that was traditional medicine trained and saw very quickly the benefit, which sometimes you see very quickly and sometimes it takes a little longer depending on what the issues are.
So one more question about the vitamins and supplement. I'm always kind of reluctant to take things. So from your pharmaceutical background, which supplement are safer to take, and how many years you already took that give me the sense in the future, what should I take?
Wow. I've been going to this doctor for decades, and I've been adding as I go. So for instance, I was deficient in vitamin C, it turned out, so I take that. I was deficient in magnesium, so I take that.
So magnesium.
Yeah, okay. Magnesium, well, that's really, you have to have, you can check everything with blood levels. So it's not good to just take things. Certain things you can check with blood levels, like vitamin D and magnesium. Other things I take to support my immune system, like vitamin C is really important. I take vitamin E for a variety of reasons. I take coenzyme Q. What else do I take? I take an iodine supplement. I have to think about this for a minute. I use a magnesium cream because I can't orally take enough magnesium to absorb. You can get side effects. Like diarrhea and stuff, so you kind of measure where you're at. I'm trying to think what else, but everything I take is for a reason.
If it's low,
I take some things like vitamin D you shouldn't take a certain amount unless your physician is monitoring you, because you could have too much, and it's good to know where you're at when you start. So vitamin D is something that you should get checked. Magnesium is something. Those are things that are standard in blood panels that physicians should run. But other things like vitamin C, it's just good, unless you're somebody that can eat a ton of oranges. It's good to have, I take a multivitamin with calcium and magnesium. I don't think the foods we eat, even though I eat really healthy and as much organic as I can, the foods we eat just can't possibly provide everything. So it's good, I believe, to take a multivitamin. But everybody has different conditions. So depending on what your situation is, there are some vitamins that are better for you or supplements that are better for you, like for men with prostate issues or for women with menopausal issues, beyond just taking replacement or to prevent osteoporosis, just depending. So there's things that you take based on the condition you have that you really don't do blood levels for, although you don't want to take too much. And there's things that you take that your blood levels guide you. So it's really a mixture of things. And I think it's important to work with somebody that's knowledgeable in those things so that you get the right combination, because we're all different. It's not a cookie cutter approach. Just like when you do acupuncture, everybody has different issues.
Yeah.
And, from somebody's history, how they feel physically, how they can report, or how you can feel based on running your hands along them. You have a different plan. I think each person needs their own unique plan, but it doesn't hurt to up some of the things like, as I said, multivitamins, vitamin C, a little bit of zinc maybe in the cold weather, depending. You can take too much of any of these and have problems. But again, if you work with somebody, and I have good physicians and I work with people like you, I just adjust from there. And then there's other things you can take. I happen to have a sensitive stomach, so if I really have a problem, I have a great Chinese herb, Saragen, that I take. So, you have to know when to use things too.
Yes.
So you have to educate yourself. I think that's the name of the game, is self-educating, working with people that understand a variety of different disciplines in medicine. And you have to learn about it for yourself, as well as just having somebody help you that's trained like Lee or other physicians. So
Thank you.
You're welcome.
Thank you
So
very
hopefully
much.
that
We learned a
helps.
lot. Thank you.
Yeah.
You can learn more about Dr. Li Zeng in her books, available on Amazon, or visit her website at www.bostonchineseacupuncture.org.